Is gut microbiome testing actually helpful? This is something people ask me a lot, and I want to talk about briefly here. The answer is yes and no. So, what do I mean by that? I've done, at this stage, hundreds of gut microbiome tests on patients. And between myself and in my clinic, we've done several thousand. And you see patterns after a while. You see overgrowth of strep and staph and yeast. So, you see what's called dysbiosis. You see inflammation, and you see a lack of short-chain fatty acid production in people's guts in general. So you get these general patterns that you see over and over again. And so you get pretty good. If you have gas, bloating, constipation, diarrhea, you feel awful after meals, you feel tired, you have foul smelling stool, you don't digest all the food you eat, you actually have food particles coming out in your stool, then you've got gut issues and you probably have inflammation, dysbiosis, and inadequate digestion. And those can be addressed by some basic interventions, dietary changes, doing an elimination diet or a modified elimination diet, using digestive enzymes, adding on probiotics. Digestive enzymes like pancreatic extracts can be super helpful, as well as some mild herbs to help rebalance your gut microbiome, using garlic, using oregano, using artemisia, citrus extract. These all can be super helpful for rebalancing the gut. So in that way, the GI tract testing isn't super helpful because most people need the basic stuff done. Okay, check. So let's say you've done all the basic things and you're still having issues. That's when the gut testing is super valuable, because it's like, what else could be going on? That's when you do testing, you'll see people having issues with certain parasites like blastocystis. You might see people having severe pancreatic enzyme deficiencies, known as pancreatic insufficiency, where they actually need prescription levels of digestive enzymes. Sometimes I'll see people with huge problems digesting fats, and they'll need ox bile support or TUDCA support. So, quick answer is GI tract testing can be helpful in certain individuals. I usually start with a basic protocol of elimination diet, removing inflammatory foods, removing foods that feed bad bacteria. Do you really need a test to tell you that you're inflamed and that you have bad bacteria in your gut? You're probably not. Do you really need a test to tell you you're digesting your food adequately and you got weird stuff growing in your gut? Probably not. But after you've addressed that with cleaning up your diet, some pancreatic support, some digestive enzymes, and you're still having symptoms, that's where a gut test is hugely important. One thing I've noted as well that I see an error that a lot of individuals make is that they keep on doing the gut testing over and over and over again, and the results don't change. And people ask me, why is my gut not getting better? And the answer is typically what people do is they'll do a protocol to fix, quote unquote, their gut for 6 or 8 weeks, feel better, then they'll stop it. And what tends to happen is your gut tends to go back to baseline. Your microbiome, about 60, 70% of your microbiome is set at birth. And you can change it through diet, lifestyle interventions, a bunch of things. But if you do those for a short period of time and then go back to life as usual, what's going to happen is your gut's going to go back to normal. And I've seen this over and over again where people will redo the testing and it kind of looks, it's a little better, but looks kind of the same because they don't sustain their gains. They don't sustain the diet changes. The question I've been asked before, when can I go back to a normal diet? My interpretation of that is, when can I go back to my standard American diet that's making most people sick and unhealthy? And the answer is, well, if you want to keep the gains, you can't go back to bad lifestyle choices. You have to maintain your diet. You have to maintain your lifestyle. And so if you're doing that, that's when additional gut testing can be helpful. Maybe even doing some more advanced stuff like a SIBO or Trio Smart or something else that looks for other tests. But the reality is most of us have some form of dysbiosis, of overgrowing bacteria, of digestive issues, of insufficiency, whether it's of stomach acid or of pancreatic enzymes. And trying to do some basic support first before doing an advanced test can be helpful. We all should be eating better. We all should be having better lifestyles. It's really interesting. You release about 25% of your pancreatic enzymes just when you sit down and take a moment to breathe, to relax, to be thankful for your meal. How often do we do that? And the answer is most people don't do that. Just chewing slowly, taking time to experience your food is going to increase digestive enzyme production. It's also going to slow the processing of food in your GI tract to give your gut more time to actually break down things. And so there's so much stuff we can do before advanced testing. But again, by the time I've seen people, they've already done most things, seen 5 to 6 practitioners, and we do the testing on them. So it's a yes and no. Is advanced testing helpful? Yes, but you really should clean up things first before you do the test, because you don't want to know, is your gut messed up as you're feeling horrible? Of course it is. The question is, if you clean things up, what's your gut look like then? And I guess that's the basic summary of this, is using it in the right situation and then maintaining your lifestyle changes, whether it's having a moment before you start your meal, whether it's being thankful when you eat, whether it's taking for a walk after a pasta di giorno or after you eat, just eating real food. Whatever changes you've made, you just really need to stick with them if you want to maintain the gains made by doing a kind of gut cleanse or changes made based on a gut test.